Welcome back. I'm your host, Carissa Farley. Today, we'll be discussing something every person needs to know to protect their health, but probably doesn't. Can a trip to the dentist improve your overall health and perhaps even save your life? We're fortunate enough today to speak to a renowned expert in state-of-the-art dentistry. Dr. Jerry Casazza is well educated in the latest developments of dentistry, and his achievements are numerous. Dr. Casazza, welcome to California and to Leading Experts.
Thank you, Carissa, and thank you for having me.
Do you think that most people have an understanding of comprehensive dental practices and that they know the difference between preventative, restorative, cosmetic, and surgical dentistry?
I think when you ask most people, they'll only think about having either their teeth cleaned or having a filling done. But today's dentist is expected to be much more than that. We are physicians of the oral cavity, and among most of the medical specialty, we are the best trained not only to diagnose but treat oral disease.
Many of us have heard in the national news about the connection between dental health and to maybe 20 different diseases. What is the oral systemic connection?
Evidence now links gum disease to a variety of health concerns, as you alluded to, Carissa. Among these are heart disease, stroke, diabetes, gout, arthritis, certain types of cancers, such as colon cancer, lung cancer, prostate cancer. It's even been linked to Alzheimer's disease, preterm low birth weight babies, Hodgkin's lymphoma, just to name a few of that list. So periodontal disease is a serious infection. It's not just about teeth anymore.
In-office blood testing is important to the future of dentistry. Let's talk more about what those tests show us.
Sure, Carissa. Another one of our tests that we routinely do is a CRP test, or a C-reactive protein test, which is a high sensitivity test. In the normal immune response, the liver produces this CRP, which is basically in response to inflammation, infection, or injury in the body. Recent evidence now suggests that CRP levels, elevated CRP levels, are associated with an increased risk of cardiovascular disease, that is to say, heart attacks and strokes. A CRP of 3 milligrams per liter, for example, is considered a high risk for cardiovascular disease. And recent evidence, in an article even by the New England Journal of Medicine, pointed out that CRP is a stronger indicator of a future heart attack and stroke than cholesterol. So given all these factors, the blood testing is of paramount importance, especially in the treatment of periodontal disease, because we can repeatedly lower the level of CRP, and in so doing, reduce the risk of cardiovascular effects and possibly reduce the risk of any other associated link.
So basically what we're learning is that we are never going to be able to look at just our dental health or our body's health without making that connection. Absolutely,
absolutely. Another one of our tests that we routinely do is the A1C test, which is a blood glucose test. It's a test that measures the percentage of glycated hemoglobin in the bloodstream. Hemoglobin is found in red blood cells. Its primary job is to carry oxygen from the lungs to the rest of the body. When you have a situation where you have excess excess sugar in the bloodstream, what happens is that sugar enters the red blood cell and binds or glycates to the hemoglobin. So when you have an elevated level of glucose or sugar, you have an elevated percentage of HbA1c, and that's what we monitor. The percentage of HbA1c gives us a measure for the past 3 months of glucose control.
You're an accredited member of Dentistry for Diabetes. What is this organization and what's their mission?
Well, the organization was founded on the premise to train dentists on the effects of diabetes on all the organ systems of the body. The mission is, really to train our patients on this and to help them control their diabetes better, and hopefully also prevent the massive amounts of pre-diabetics from going into the diabetic condition.
How do you view your role as a healthcare provider?
Well, Carissa, the most common chronic infection in this country is gum disease. And most people will often see their dentist, much more often than they see their physician. So I think the dentist has a paramount responsibility here to not only address the patient's oral needs, but their systemic needs as well. And I think that the future of dentistry, lies in the prevention of disease, in the prevention of, from a simple, cavity, to the prevention of oral, cancer, to the prevention of a possible systemic condition.
So now if we do know there is this overall connection, what about my health habits? Can there be other things that affect this, such as smoking or drinking or exercise routines?
Oh, absolutely, and we get into that as well. Again, what we want to try to do is to assess where the problem is. If it's not coming from the periodontal disease, then we rule that out, and so we go from there. And where else is the problem? And obviously the lifestyles come into play, the alcohol, the smoking, etc. And we're all familiar with those kinds of things. It's the undiagnosed things, that we cannot see, that our goal is aimed at.
So you're striking me as a cutting-edge dentist. You're prepared to have a conversation with your patients now about overall health?
Absolutely, and we do on a daily basis. Because most patients are unaware, that those things are actually happening, aside from the little snippets that they may read in the media. We actually educate them on this role and how important and vital it is, for the periodontal disease to stay under check.
If I'm a patient and I haven't seen this show and I don't know to have this conversation with my dentist, do you help ask those questions? If somebody comes to you, will you help create that conversation with your patients?
Absolutely. We actually initiate the conversation, and we kind of, in a nice way, educate them on all these things. And some people, want to hear them, and some don't. But our responsibility is to get the information to them, because again, we're treating the entire person, not just their oral condition.
Are you finding the physicians are receptive to this kind of conversation? What if a patient goes back and the doctor seems unreceptive to hearing information coming from a dentist? That's
the problem. That's the problem, because physicians are accustomed to not listen to dentists. And whenever a referral comes from our office, suggesting that they follow up on certain care, they will tend to not pay as close attention, perhaps as they should. I think that's going to change, though, because I'm seeing more and more each day the opposite happening, whereby the physicians are actually calling us and telling us to perform a good oral diagnosis, because whether it's from the gynecologist, whether it's from the gastroenterologist, we have all the, and the cardiologists are actually, for the first time, in my 20 years in practice, have never seen that. And now I'm beginning to see that trend. And I think that will continue for years to come. As I said earlier, I think the relationship between dentistry and medicine will get tighter, again, for the purpose of overall health.
Dr. Casazza, this is hugely important for the people watching this show so that they can advocate on behalf of their own health. Is there anything else that a patient needs to know other than finding the right dentist or finding someone who is educated in this school of thought?
Well, there's no question that your dental health is connected to your overall health. A lot of the areas of research, there are a lot of gray areas, but the links cannot be ignored. They may not have a clear understanding of how the link actually happens, but nevertheless it exists. There are many diseases that we didn't know about, and now all of a sudden, we know that the mechanism of action. So I guess one of the questions will be to ask your dentist if he's even on top of this information, and to kind of sit by him and just have a normal conversation about your mouth and how important it is, and what you've heard and what you read about, and to kind of listen to the philosophy of practice that they preach. If they're not to your liking, or to then I would advise you seek another dentist.
Thank you, Dr. Casazza, for coming to California and educating us on these latest developments in dental health.
Thank you, Carissa.
That's it for this edition of Leading Experts. I'm Carissa Farley. We hope to keep you up to date in the most important and interesting topics of the day.